Welcome everyone. We're streaming live on Facebook today, and I have a very special guest, Dr. Zubin. Before I introduce him, I just want to introduce myself. My name is Janice Amiro, and I am the founder of Janice Inspiring Change Holistic Nutrition. More information can be found about me and the work that I do on my website. It's janiceinspiringchange.com. So today, like I said, we have Dr. Zubin on the call, and he is joining me from Mumbai. It's interesting because I met Zubin at the Truth About Cancer conference in California about a year and a half ago, and we became friends immediately. So today he's joining me. Welcome, Dr. Zubin.
Thank you, Janice, for having me on the program, and hoping to take you on a journey on mistletoe.
I can't wait. I'm so excited to learn more. So before we get started, I'm going to introduce you. Dr. Zubin is a senior integrative medicine physician and practicing classical homeopathy in the city of Mumbai for 29 years. Dr. Zubin developed a deep desire to treat challenging medical ailments very early in his medical career. This led him to the field of cancer and mistletoe therapy, which we're going to dig into. He then proceeded to Switzerland, where he trained at the Lucas Clinic, now called Clinic Arlsem, and in anthroposophical medicine and mistletoe therapy. In 1994, he worked as a guest doctor in that clinic to gain clinical experience. Since then, he has been treating patients in different stages with mistletoe therapy and homeopathy. Many of his patients have been cured, and terminal cases received palliative treatment wherein their suffering was minimized and last moments were peaceful and a totally different experience than it would have been otherwise. Around 11 years ago, Dr. Zubin wanted to learn the art of science and integrating different types of therapies in cancer. This led him to discover the Department of Integrative Medicine at the Sloan Kettering Cancer Center in New York. He was invited as a clinical observer at Memorial Sloan and also delivered lectures in the department at the Palliative Care Center. Dr. Marolia is invited to deliver a lecture at the esteemed Johns Hopkins University School of Medicine in Baltimore in 2013. He spoke about the thought patterns in cancer patients before malignancy develops, and that's something we're going to talk about today. Before a person actually has cancer, what goes on? Dr. Marolia was invited to share his healing stories at the Beaumont Hospital in Michigan and at the University in Vienna. He has conducted seminars on mistletoe therapy in Seoul, South Korea. He is regularly invited to deliver lectures at the IMM conference in Helixer, Germany. In 2019, he was invited to share his concept of the 3 S's of health at the Truth About Cancer conference in Anaheim, California, and that's where I met him. So my goodness, welcome. I'm so pleased to have you with me today. And if you want to say just a few words after that introduction.
Hi, Janice, and a warm welcome to everyone in this very interesting program on mistletoe, the kiss of life. And Janice, thank you for the kind words of introduction. It was a warm meeting with you in Anaheim, California in 2019, where I was invited to speak about my concept in healing not only cancer patients, but also other chronic ailments. My concept, which I have propounded, the 3 S's of health. But the program today, I think, mainly is to bring awareness on a therapy which is becoming very, very popular in the treatment of cancer all over the world. Not only in the early stages, wherein you cure cancer patients, but also side by side with chemotherapy and radiation and also in the terminal stage of cancer when the patient is in the end stage of life. So, Janice, thank you once again for having me on your program.
Thank you. Let's get started. And so I guess the first thing that we'll talk about is mistletoe, because maybe some people have heard about it, maybe some people haven't, but we want to know, I want to ask you what exactly is mistletoe, and then we'll talk a little bit more about it.
So mistletoe is basically a half parasitic plant that grows on host trees in European countries and other parts of the world. And the basic extract of the plant is used to make injections to be used in cancer treatment. So let me go on a journey 100 years ago in the year 1917, wherein the founder of anthroposophic medicine, Rudolf Steiner, found there were similarities of the mistletoe plant with cancer. And these similarities were very, very unique. For example, the first similarity was that the mistletoe, when it grows on the host tree, it grows in all directions, just like a cancer also grows in all directions. The mistletoe is basically a half parasitic plant growing on the host tree, just as a cancer, a tumor, grows on the human host. Another similarity was that where the mistletoe plant grows on those branches of the host tree, those branches are sustained longer than the other branches where the mistletoe does not grow. And also, the point at which the mistletoe plant grows on the host tree, there is a protuberance, a nodular growth-like structure at that particular point, just like in cancer, we have a nodular, we have a lump, etc. So those similarities were very, very unique between a plant and a disease. And that's how mistletoe came to be used in cancer treatment way back in 1917. So it's been a journey of about 103 years. And in 1963, the Lucas Clinic was established in Alzheim, in Basel, in Switzerland. It's a holistic cancer center wherein cancer patients come and they take mistletoe therapy and other anthroposophical treatments to heal themselves. So we are talking about a program today, a plant today, which has a history in medicine for treating cancer for 100 years and also for other ailments in European countries like sciatica, low blood pressure, arthritis, much before it was used in cancer treatment.
So how is it that it helps? How is it that you can? What does it do to the host, to the cancer patient, and to the tumor? How does it work?
So I was always intrigued on the mistletoe, and this was way back when I began my journey. And I've always believed every patient has a journey, every human being has a journey. So I will take a few moments over here, Janice, to tell about my journey. So after my graduation from the Medical University in Mumbai, I was intrigued when I came to know about the mistletoe and how it contributes not to controlling the tumor, but how it contributes in the quality of life of a cancer patient. For example, when I was seeing cancer patients in Mumbai 30 years ago, in 1991, I saw a cancer patient with advanced cancers coming into the clinic, very weak, debilitated, lack of appetite, nausea, depression. And after a few injections of mistletoe, a few weeks, the patient walks better, the patient's quality of life is better, the nausea, the pain, etc., the debility and the weakness is better. So I saw and I experienced that mistletoe contributes in a very holistic way in the cancer journey of a patient. And that's what really caught my mind. And that's how I began my journey in 1991 in the Lucas Clinic. And as you mentioned, in 1994, I worked as a guest doctor in the Lucas Clinic and began using mistletoe in India for cancer treatment. So mistletoe, Janice, yeah.
I just want to reiterate a point that, you know, there's so much, the fact that this helps all parts of the person. It helps improve the overall quality of life of the person, is something that is often overlooked. And because most of the time we focus on some types of therapies focus on the tumor and not the quality of life of the person. So you're saying that mistletoe is works on the quality of life and can help with the tumor as well.
Absolutely, absolutely. I think we should all understand a change in the paradigm of medicine today, Janice. Today, personalized healing and knowing a patient is more important than knowing the disease. I think
Yes.
we should all realize that, and that has been a very important point and a very important focus in my practice.
Mm-hmm.
Sir William Hostler had mentioned, I quote, "It is more important to understand the patient who has the disease and not which kind of disease is there in the patient."
Yes. Yes, exactly.
And
I'm
so
really
true,
glad you said
and
that.
so true for cancer. So
Mm-hmm.
when I go on a healing journey, as we will discuss today in the program, when we start mistletoe therapy and we know the healing journey of a cancer patient, I want to know what has happened 10
Mm-hmm.
to 12 to 15 years in the journey of life of a cancer patient before the tumor has developed.
Right.
So you are
Right.
shifting your entire focus to a 10 to 15-year period before the cancer develops.
Mm-hmm.
And
Mm-hmm.
that is never done by an oncologist, by a conventional doctor. They
Yeah.
only look at the tumor, and it's what is called as a loco-regional concept, wherein you only look at the tumor, you remove the tumor by surgery, you blast the tumor, you kill the cancer cells. What about the patient?
The person. Yeah.
What about the person, Janice?
Yeah.
That's important. And that
Yes.
will be the focus of our program today.
Yes. Let's just go back. Before we continue, I just want to, for our viewers, I just want to say that we are chatting. I'm chatting with Dr. Zubin Marolia, and he is a senior integrative medicine physician, and he practices classical homeopathy in Mumbai. And we're talking about mistletoe therapy, and we're talking about the approach of looking at the cancer patient and not just the disease. So let's talk again, go back to how mistletoe works. So you said that it helps the whole person, there improves their quality of life. How else does the mistletoe work?
All right, so a little bit about the pharmacology of mistletoe. So the mistletoe plant is harvested in both the summer and the winter months. And the extract, the mistletoe extract, is a mixture of both the seasonal plant extracts.
Mm-hmm.
And it contains lectins, which are glycoproteins, which are known immunomodulators. It contains viscotoxins, polysaccharides, alkaloids, etc. So mistletoe basically works in four ways, Janice. The first one being, as we all know, it is an immunomodulatory therapy wherein it strengthens and stabilizes the immune system to help the cancer patient fight the tumor. Number one, in the immune modulation and immune stimulation, it particularly stimulates the population of NK cells or the natural killer cells, which are so very important in attacking the cancer cells. So you have a therapy that is immunogenic, and that's a very, very big plus in cancer treatment today because all conventional therapies are immunosuppressive.
Mm-hmm. Mm-hmm.
Number two, mistletoe always supports the immune system and supports the body when you take mistletoe along with chemotherapy and radiation. So it is known to lessen the side effects of chemotherapy and radiation when taken alongside conventional therapies.
Mm-hmm.
Many times I have a cancer patient and they come to my clinic and I always welcome them, the whole family. I always want the whole family to come to my clinic, the patient, the son, the daughter, the husband, the wife. That's where the support comes in with the patient. It's the family that's very, very important. And then we sit down and we discuss the integrative oncology protocol, which I will advise for the patient. And we go on a healing journey where we talk about life, we talk about what's happened in your life. Of course, we talk about the cancer, but we also talk about what has happened in your life
Mm-hmm.
10 to 15 years
Yeah.
before the tumor develops. So the second point I mentioned, the first point on mistletoe, how it works is It's basically immunomodulatory. The second point is that it helps to lessen the side effects of chemotherapy and radiation. Thirdly, it helps to improve the quality of life via neuroendocrine regulation, wherein it is known to lessen pain, improve the activity of a patient, lessen the weakness, the debility, and also help in the mood and other parameters.
Okay.
And fourthly, also that mistletoe also is cytotoxic. It also has a direct action on the cancer cells, and it kills the cells by a process what is called as apoptosis, programmed cell death.
Right.
So Janice, you have a molecule in medicine today, in mistletoe, that is not only immunogenic, it is also cytotoxic. It destroys the cells, builds the immune system, lessens the pain, the suffering of a cancer patient, and can be taken alongside chemotherapy and radiation. So you have a biologically complete molecule in mistletoe in cancer therapy.
And so it sounds like a miracle, really, doesn't it?
Mistletoe, the M for mistletoe and the M for miracle. I'll tell you of a small miracle, Janice. I had a patient of cholangiocarcinoma with a relapse, and they were giving chemotherapy. The patient had a platelet count of 16,000. The normal count is about 1,50,000 to 4,50,000. She came to me with a count of 16,000, and we were on mistletoe, and she developed on the 4th day of mistletoe. She gives me a call that she feels better in the weakness, and the platelet count stabilized, and she went up to 40,000, 80,000, and normal count of 1,74,000. So you can imagine how the platelet count has been built up in this patient with mistletoe therapy.
Wow. Wow. Yeah. So so we can get back to a little bit of mistletoe, maybe if we have time at the end, but the second part of what I wanted you to speak about today, and what I wanted the viewers to hear, was this revolutionary concept that you have created. You call it the 3 S's. And that is a part of your approach with every single person who walks into your clinic. So can you give the viewers some information about the 3 S's?
All right. So as I began my journey in medical practice in 1991, I made it a point, Janice, to sit down with patients over a cup of tea, coffee, and listen to their story. In fact, I'm known in my practice by one line, I always want to hear your story. Tell me your story. Many a times patients come with a stack of reports, and they tell me, oh, this is the tumor, this is the histopathology of the tumor, and this is the chemotherapy and radiation. I don't want to hear that. I want to hear what is your story. And when I listen to these stories about 5 years, 10 years, 15 years, 20 years, I came to realize that there are 3 S's which are so very important in healing, and which contribute for a person to be healthy in mind, body, and spirit. So we shall go on a journey of the 3 S's now.
Okay.
The first S is the S of suppression. This is the S of heaviness, wherein a patient is not able to express himself or herself, has suppressed their natural energy flow in the body. And the suppression can be due to various emotional factors. It can be due to grief, loss of a near and dear one, death of a family member, a PTSD, loss of ambition, grief, guilt in life, etc. So suppression is when you want to do something and you're not allowed to do it, receive a blockage, and that blockage is expressed as a blockage in the natural energy flow in the human body, and that's where the disease starts. The energy of the human body has a flowing pattern, has a uniform pattern, and it has to flow in a uniform way. When it gets blocked is when you develop disease in that system. The first is of suppression.
Can I just interject here? I think that this concept that you just explained here, in my opinion, and working with some cancer patients, and disease in general, as a holistic nutritionist, I think that this is something that a lot of people don't know about. This is a concept of the concept of the link between what is going on with the person and their illness. They don't, there's a disconnect. There's a lot of people don't know that there is a connection here. And I think that that's where what you do and what a lot of us in the holistic wellness field do is we don't just look at the problem. We look at what's going on in the body, no matter what the illness is, and where is it that there's a big there's a disconnect there, and looking at trying to get the client to see where there's an imbalance, because where there is an imbalance, there's going to be somewhere that you can look at that, and when you rebalance that, that's when the wellness begins. Am I right?
Absolutely, Janice. I will give you an example. I had seen a breast cancer patient many years ago in the left breast, and she came to my clinic, and she was very quiet, very glum, very morose. She was sitting in the clinic, and I used to ask her numerous questions about her journey, and she would just keep quiet. She would never answer any single question. We spoke about her disease, breast cancer with metastasis to the lungs. And I always want to know what happened before the disease started. And on a very sensitive note, I came to know from her sister through the family medical history that there was an episode of molestation on the breast where she developed the breast cancer.
Right. Mm-hmm.
So you can imagine that we were able to establish the mind-body connection,
Mm-hmm.
and that disconnect that is there in medical science is what I am there to rebuild, to make a patient understand that there is a connection between how you feel, how you flow your energy in the body, and your disease.
Mm-hmm. So that suppression, if that suppression is never addressed year after year after year, then that creates some type of illness in the body.
Absolutely, Janice, absolutely. I will give you another example. I had a case of ovarian cancer in a 54-year-old lady that came to my clinic, taken chemotherapy, operated. She came with a recurrence, and she had pelvic lymph node metastasis. And she had a very, very huge left lower limb due to lymphedema, wherein the leg was swollen because of the lymph nodes in the lower abdomen were blocking the blood flow and the lymphatic flow. And when I took her history, she always used to express one point, that I have never been able to really live my life freely because of poverty, because
Mm-hmm.
I've been working all my life. I faced severe financial constraints in my life. I've never been able to enjoy my life socially and also enjoy the pleasures in life. And you give me some medicine, Dr. Marolia, so that I can work. And in her healing journey, she always used to express this one particular sentence, and I remember it even today. So, Doc, give me some medicine so I can work, so I can earn some money from my family, and I can support my children and my husband.
Mm-hmm. Mm-hmm.
This particular core that I mentioned, and she always used to feel suppressed because if she wanted something, there was no money to fulfill it.
Right.
And that particular statement, that particular essence of her human mind was understood in a homeopathic remedy, which has this particular fear of poverty.
Right.
And the remedy is Calcarea florica. And that remedy was given to her, and she was on mistletoe therapy. And after about 2.5 months, her anemia settled down, her discomfort in her leg settled down, and she began working. Her
Wow.
appetite improved in about 6 weeks' time, and she began working. And she gives me a call from the bank, said, Doc, I've begun work. Thank you very much.
Wow. Wow.
So you can see how you have established the mind, body, spirit connection.
Mm-hmm.
So that was the first S of suppression.
So the second S?
The second S is my favorite S, is the S of spontaneity. So if you
Yes.
want to do something, you go ahead and do it. It's very, very important. And many a times when you are spontaneous, it's a childlike trait, Janice. And it's very, very important for each and every one of us to have a childlike trait. For example, you see a ball on the ground. What is the first impulse a child will do? The child will run and will kick the ball. Many a times we try and stop the child. So don't do it, not to do, kick slowly, etc. So it's very, very important to have that spontaneous energy in you and that spontaneity in you, wherein you go with the flow. You want to do it, you go ahead and do it.
Right. And so with that comes when we are more spontaneous, how does the mind connect? What's the difference in the mind? How does the mind connect to or maybe I should say, how is it that the body improves when we are more spontaneous?
Spontaneity basically is an impulse wherein you are giving a jump start to the vital energy in the body. It's like a kick to the vital energy. And that spontaneous act might not have any reasoning or meaning to it. It comes from your instinct.
Yes.
And when it comes from your instinct, it's basically a jump start to your vital energy. And all those people who do activities spontaneity, I think they can feel the pleasure themselves.
Yes. Yeah. And so the third S.
The third S is to live life with a free spirit, to welcome the energy of the world, to absorb the energy and give back the energy to the world, to have a spiritual flow. That's very, very important. And I think I'm known the world over. When I travel the world, I always do this one particular posture. I don't know whether you've seen it, Janice, where you spread your arms and you welcome the energy of the world.
Yes.
And that's how you become a free spirit.
I do that when I see the sun every day. I hope to see it every day. Now that I'm in Canada again, I don't see it every day, but you know, even when I was in Qatar, I just absolutely love that. And I open my arms to the sun all the time because it just brings so much energy to my body.
Absolutely. In fact, I tell my patients in the clinic after a session, a consultations, open your arms and you feel the energy of the universe.
Yes. So when you begin your conversation with your patients, the first thing that you ask them is for them to tell you their story. Is that correct?
Absolutely.
And so based on that, how do you proceed? What I think we can go to the protocol, which is what I wanted to ask you about, the protocol for each patient. So once you learn their story and where they're coming from, how do you go? What's the next step, and how do you go through that plan to get them to where they want to be, or where healing can begin and wellness, they can get back to normal living again?
Great, Janice. So once we understand the healing journey of a cancer patient, we always try to understand the 3 S's. Was there any suppression? Where was the lack of spontaneity? And do you live life like a free spirit? Mainly, we look at certain emotional factors which lead to suppression in their lives, like grief, like lack of ambition, like financial problems, post-traumatic stress disorders, abuse, etc. So it's basically a journey wherein a patient is sensing what's happened to themselves in the life journey. And I do a process of this particular healing journey session wherein we undergo a process of reorientation. Somewhere subconsciously, the patient undergoes a reorientation process and comes to realize what has gone wrong in their lives. So when we establish and we understand the entire healing journey, we understand their emotions, their behavior patterns, etc., and their physical aspects, their diet, their sleep, their dreams. It's a 1 hour session, sometimes a 2 to 3 hour session. And I would like to mention over here of a quote which I read by Dr. Suzanne Coven. Storytelling is really where the medicine is. It's your story which signifies what has gone wrong in your life that has made you ill. And that's why every patient, I believe, should have a primary care physician who is willing to listen to you, to listen to your story, to listen to your journey. Unfortunately, that does not happen. Because even here in India, we know doctors are very hurried and they hardly give time to a patient. In fact, on a very, very sensitive note, in the Truth About Cancer series video, I have interviewed an ovarian cancer patient, and she is known as the Biscuit Lady, wherein she comes to my clinic at the same time where I go to have tea at a local cafe, and she comes around that same time from her work, and she gives me a pack of biscuits. And many a times I invite her for a cup of tea, and we have a cup of tea together. That's the close bonding and the relationship between a patient and a doctor. So when we understand the whole healing journey, the mind, physical body, and the spirit, and then we understand the constitution of a patient, and then we prescribe a homeopathic remedy or a Bach flower remedy, and we make sure that there is a certain level of reorientation in a patient's life. We advise on nutrition, we advise on meditation, on yoga, and we form what I have been using as the healing journey protocol for my cancer patients here in India and at the India Center for Mistletoe Therapy and Research. So the first one that we have is the healing journey. The first step in treatment is the healing journey. Second is homeopathy. Third is mistletoe. Fourth, you use vitamin C, B17, and curcumin.
Okay.
And we also advise certain ancillary measures like yoga, meditation, dietary aspects, etc. also. This is what I've been doing in my practice, and it has helped many patients up to now.
So your approach is what we are trying to do in the kind of holistic world is the approach of the mind, body, spirit. And in your clinic, you take all of the aspects and you put it together, and that is your protocol for the patient. So it would be different for each person. Is that correct?
Absolutely, because you are looking at the person. You're not looking at the disease. So it would be an entirely personalized healing approach. You can call an individual personalized healing approach.
There's no cookie cutter type of solution with this type of with what you're offering is very individualized. It isn't a one size fits all approach. It's depending on that particular person and what their whole story is, what they've been through, where they're at the time, and so looking at that mind, body, or addressing mind, body, spirit is where you're going to get the best results.
Absolutely. Let me give you an example, Janice. I had a patient about 4 years ago, a breast cancer patient, operated and advised chemotherapy. And she had an extreme fear that she would lose all her hair when she would take chemotherapy, a normal side effect of chemotherapy.
Yes.
And she came to me with a desire that I would give her something in an integrative way. We'll come to the integration aspect a bit later. So I asked her, I said, tell me your story. What is troubling you as of now? So she says that I'm petrified, doc, that I'll take the chemotherapy, which I'm going to take it, and I'll lose my hair. I'll lose my hair. I'm very scared. Fear. This fear aspect was understood in homeopathy, and we gave her a homeopathic remedy called Aconitum napellus. and we addressed that fear. And very interestingly, she had come to me with a urinary tract infection. And with that homeopathic remedy, that infection cleared, she was fit to take the chemotherapy and the subsequent radiation. So herein comes the aspect of integration. I think this is a very, very important aspect, Janice, in our program that we must discuss. Even though we go on a healing journey protocol, I mentioned my protocol, many of my patients who are young want to do chemotherapy and radiation side by side with homeopathy. And so we said, that's fine. It's your calling, what you want to do for your healing. It's very, very important. It's your call. So we integrate mistletoe therapy and homeopathy into the lifestyle and the well-being of a cancer patient.
I see. So because I'm wondering, and probably some of our viewers are wondering, how is mistletoe given to a patient?
So
What
mistletoe
is
is
it?
right. So mistletoe is basically administered in a very standard way. They are subcutaneous injections given every alternate days. And the therapy is evaluated based on two aspects. One is the local reaction, the redness reaction. Okay, at the site of the injection, there's a small red wheal with itching and warmth, and a generalized feverish reaction or a warmth feeling in the body. So the first mode is a subcutaneous injection. Second, in advanced cancer patients with metastasis, wherein we find the cancer is growing very fast and the vital parameters are not doing so good, we give intravenous mistletoe therapy.
Okay. Yeah.
Also, mistletoe is also given in open tumors, in ulcers, as a local instillation. You pour the mistletoe on the ulcer, on the cancerous fungating ulcer, as a local reaction to mistletoe. And lastly, mistletoe is given inside body cavities with collection of fluid, what is called as an intracavitary infusion. Like in chest pleural effusions, we do a pleural tapping and we instill mistletoe. For abdominal fluid called as ascites, we do an intraperitoneal mistletoe installation.
Okay.
But subcutaneous injection is the standard mode.
Right.
I have been seeing a very disturbing trend wherein people are given intravenous mistletoe in very high doses right from the beginning in certain parts of the world. And the dose is very, very high. So always remember that it's always mistletoe has to be given in a subcutaneous manner. You evaluate the response of the patient, the response of the immune system, and you build on the mistletoe injection. Yes. So you always give it subcutaneous and then intravenous. You do not go to the intravenous mistletoe installation in the beginning.
You start out a bit slower and see how the body reacts.
Absolutely.
Right. It makes perfect sense. Yeah. So homeopathic therapies can be taken when the patient is at home, or is that also given just at the clinic?
They can take it at the clinic and also in the hospital as well. I had a patient of leukemia in a Mumbai hospital many years ago, and she had developed a thrombus in one of the veins and with swelling of the entire upper limb. And we gave her homeopathic remedy, and she did very well along with the conventional therapies. So I think a very, very important part of treatment of a cancer patient is integration. Like I mentioned, integration in the line of treatment, integration in life, and integration in the support a cancer patient derives for him to fight and be well on the journey.
And I just love the fact that you're doing this type of practice, that you look at the whole person and you give that you offer what that person needs, not just for the cancer, but for healing in general, and looking at the root cause of where why that person has that tumor and where that stems from. And when you dig deeper and you learn the person's story, then you are able to start from there and start to extract all those beliefs and all those fears and all the reasons why, so that then they can go on this healing journey and become well again. I think it's the way we should be doing this, in my opinion, and the results speak for themselves.
Absolutely, Janice. In fact, when we spoke about suppression, if you really ask a patient who falls sick, what is the first sign of illness? First sign of illness, whether you have a fever or a sore throat or a migraine or a cold, I've always seen this point at a very, very subtle level. The patient always says, I feel heavy. There is a bit of heaviness, heaviness of the head, heaviness of the body, not able to move, and feeling dull. Number one is heaviness. Second is weakness. You feel low, you feel tired. So when I ask a patient, when I give a homeopathic remedy, whether it's a cancer patient or any chronic illness case, I always ask three questions, are very, very important in healing. Number one, are you feeling fresh? And patients, most probably when they receive a constitutional homeopathic medicine, they will first come and tell you in the next 48 to 72 hours, they will feel fresh, number one. Number two, they will feel light. They will feel light. And number three, they will feel a sense of freedom. And that's where healing begins.
So right.
It's very, very important to ask, how are you feeling? It's very important.
Yeah.
In your follow-up of patients.
And, you know, I mean, for myself, I went through an amazing healing crisis after being diagnosed with a debilitating illness. And so once you start on that journey, you go through, you know, what you go through is incredible, and it's different for everyone. But when you wake up and you feel fresh, that is truly a gift. And that is what gets you going. That's what gives you the zest for life. When you feel freedom, when you feel fresh, when you feel energetic, and you give that to people after they get started on your protocol. So I think have we covered everything that you had thought we would cover today? Because I guess we're just about going to wrap things up.
Well, I think yes, Janice, we've covered mostly everything. I would again like to reiterate that to all the people around the world who are watching the program, you must find a healing journey physician. You must find a physician who will listen to you holistically, who will listen to your journey, and that is where healing really begins. And I think we've covered mostly all the aspects. I've mentioned about mistletoe, how it works. Of course, mistletoe is a long webinar as a therapy in itself, but it has helped many cancer patients to live their lives in a very, very holistic manner, in a very, very structured manner. And I think we've covered nearly everything. And if I'm able to bring about a change in the way the world practices medicine, in the way patients are healed, I think the purpose of this program is served.
And you are doing exactly what you are doing. Exactly that. You are approaching wellness in the mind, body, spirit approach, and that is what gets results. And we've seen it over and over again. You've seen it. I've seen it. This is what gets results. Dr. Zubin, can you, if anyone would like to have more information about you, what you do, and how to contact you, could you give us those details, please?
You can forward my email address. They can write me an email. I'm also the founder of the Mistletoe Cancer Therapy Group, wherein we address many questions on mistletoe therapy. And there are any queries, if I'm able to bring about a change in the lives of a person, then I think they can contact me. We also have a center in India now called as the India Center for Mistletoe Therapy and Research, wherein we work in an integrative manner. We have different people who come together and we address patient concerns. We want to know what the patients want, and then we address their concerns, and we bring in different therapists. And I plan the entire healing journey protocol, which is best suited in personalized healing. So it's a personalized healing approach which I develop for every patient.
Okay, great. So the Facebook group, just again, is Mistletoe Cancer Therapy Group on Facebook. Am I right? So
Right.
you can request to join that group, and Dr. Zubin will let you in, and from there you can get more information about mistletoe therapy, about Dr. Zubin, and so I can't thank you enough for today. Thank you so much for joining me. It's an honor to sit with you again. And I really enjoyed our conversations over the 3 days that I was in California. It went by so fast. And I was like a sponge just taking all this information in. And I really appreciate you taking the time that during that weekend to sit with me and introduce me to some other people that are doing similar work. And thank you. Perhaps later on we can have another conversation on in my program, Inspiring Change 2021, so that you can talk about more about what you do and how you help people. So thanks again. And this is Janice Amiro. I am the founder of Janice Inspiring Change Holistic Nutrition. You can contact me via my website, janiceinspiringchange.com, or on Facebook at this link that we're on today. And thanks so much, everyone, for tuning in. And I'll see you next week for another live show on Thursday. Bye for now.
Thank you, Janice, for having me over. It's always healing at your core. It's always healing with a personalized healing approach. Thank you very much. And I wish the world would recover from the COVID crisis. I wish good health in mind, body, and spirit. Thank you very much for having me over.
Thank you very much. Bye, everyone. Bye.